The first ever treatment for severe frostbite has been approved by the FDA. It's an injection that opens up blood vessels and prevents clotting. The treatment is meant to reduce the risk of finger or toe amputation in adults. And joining us to talk about this and our other health headlines, Dr. Jeff Pothof, UW Health's Chief Quality Officer. Doctor, great to see you. I know it's almost 50 degrees out. Usually it is cold this time of year, and this is something we do see here in Wisconsin. How big of a deal is this?
You know, I think this is helpful because we don't really have a lot of effective options to treat frostbite. A lot of time it's supportive. We make sure that the wound doesn't get infected. We keep it clean. Sometimes we give antibiotics. In some cases, we can give clot busting medications, like the same things we use for stroke. But having a medication that's been proven to be somewhat effective in the treatment of severe frostbite would be helpful. It basically dilates the blood vessels, prevents or makes it less likely that we'd have poor flow into those tissues that need blood to recover. It makes it less likely that we get those small blood clots that interrupt the flow of that healing blood to those tissues to give people a better chance. This study did show a little bit of a decreased rate of amputation in folks who got this treatment.
I learned today I don't know a lot about frostbite because I assumed once you get that severe case, I mean, like your fingers are turning black, that was it. You got to get them chopped off. But no, this tells you over a long period of time, the human body is pretty amazing if it's given some help here. And over 6 or 7 days with treatment, you can kind of not have to deal with the most severe consequences?
Yeah, absolutely. I mean, you can imagine no one wants to hear someone tell them that they're going to lose some fingers. So that's a big deal to people. And it's not to say that this treatment will save everyone, but having more options that reduces the risk of losing your fingers or your toes or your ears, that's a pretty big deal for some people.
Yeah, especially when you live in cold weather climates like we do, and obviously these things happen. All right, let's talk about booster shots with COVID. CDC is considering spring booster shots for some people. Who may need that spring boost?
Yeah, so this will be for those individuals who are high risk for severe disease. Examples would be people undergoing cancer treatments, people who've had organ transplantation, people with immunological diseases like rheumatoid arthritis. And this probably makes some sense. So we know that after you either get COVID or you get boosted for COVID, you have great protection against severe disease for about 6 months. And if COVID was like the flu, where we really only saw it between like October and February, one booster in the fall would cut it. But we see COVID year round. So reboosting those folks as they start to get to late spring, early summer, protects them against those COVID cases that they might encounter during the summer because they're at higher risk of getting severe disease from it.
But for most of us, it's just going to be like the flu shot, right? It's a fall-time shot.
Yeah, for most of us where we have good immune systems, we're likely not to get very sick even if we got COVID in July. A once-a-year booster will likely keep that immunity high enough where we won't have to worry about it like those with a poorer immune system.
We've only got like 20 seconds here, but good news for people diagnosed with melanoma. Tell us about this new treatment, this new therapy.
Yeah, this is a new treatment, and it's cell-based therapy. So basically, we teach the person's body how to create or attack their cancer, much more targeted than chemotherapy. This initial treatment looked like it, completely eliminated their melanoma in about 4% of cases, went into remission for about 40% of cases, up to 18 months. So not a miracle drug, but a step in the right direction for a cancer that's notoriously hard to treat and cure.
I just want to shout out science. It fascinates me every time. Dr. Pothof, so much fascinating things happening out there. Appreciate your time.